Q and A. N, C, L, E, X, priority. The nurse must know that the most accurate oxygen delivery system available is A. The Venturi mask. B. Nasal cannula. C. Partial non-rebreather mask. D. Simple face mask. 1A. The Venturi mask. The most accurate way to deliver oxygen to the client is through a Venturi system, such as the Venti mask. The Venti mask is a high-flow device that entrains room air into a reservoir device on the mask and mixes the room air with 100% oxygen. The size of the opening to the reservoir determines the concentration of oxygen. The client's respiratory rate and respiratory pattern do not affect the concentration of oxygen delivered. The maximum amount of oxygen that can be delivered by this system is 55%. 2. A client arrives in the emergency department after a radiologic accident at a local factory. The first action of the nurse would be to A. Begin decontamination procedures for the client. B. Ensure physiologic stability of the client. C. Wrap the client in blankets to minimize staph contamination. D. Double bag the client's contaminated clothing. 2B. Ensure physiologic stability of the client. The nurse must initially assist in stabilizing the patient prior to performing the other tasks related to radiologic contamination. 3. The nurse is caring for a client on complete bed rest. Which action by the nurse is most important in preventing the formation of deep vein thrombosis? A. Elevate the foot of the bed. B. Apply knee-high support stockings. C. Encourage passive exercises. D. Prevent pressure at back of knees. 3D. Prevent pressure at back of knees. Preventing popliteal pressure will prevent venous stasis and possibly deep vein thrombosis. 4. If a very active 2-year-old client pulls his tunneled central venous catheter out, what initial nursing action is appropriate? A. Obtain emergency equipment. B. Assess heart rate, rhythm and all pulses. C. Apply pressure to the vessel insertion site. D. Use cold packs at the exit incision site. For C, if a central venous catheter is accidentally removed, pressure should be applied to the vein entry site. 5. The nurse assesses several postpartum women in the clinic. Which of the following women is at highest risk for puerperal infection? A. 12 hours postpartum, temperature of 100.4 degrees Fahrenheit since delivery. B. 2 days postpartum, temperature of 101.2 degrees Fahrenheit this morning. C. 3 days postpartum, temperature of 100.8 degrees Fahrenheit the past 2 days. D. 4 days postpartum, temperature of 100 degrees Fahrenheit since delivery. 5C. A temperature of 100.4 degrees Fahrenheit or higher on 2 successive days, not counting the first 24 hours after birth, indicates a postpartum infection. 6. The nurse is caring for a client with a chest tube. On the second postoperative day, the chest tube accidentally disconnects from the drainage tube. The first action the nurse should take is A. Reconnect the tube. B. Raise the collection chamber above the client's chest. C. Call the healthcare provider. D. Clamp the chest tube. 6D. Clamp the chest tube. Immediate steps should be taken to prevent air from entering the chest cavity. Lung collapse may occur if air enters the chest cavity. Clamping the tube close to the client's chest is the first action to take, followed by healthcare provider notification. 7. A client is placed on sulfamethoxysultrimethoprim, Bactrim, for a recurrent urinary tract infection. Which of the following is appropriate reinforcement of information by the nurse? A. Drink at least 8 glasses of water a day. B. Be sure to take the medication with food. C. It is safe to take with oral contraceptives. D. Stop the medication after 5 days. 7A. Drink at least 8 glasses of water a day. Bactrim is a highly insoluble drug and requires a large volume of fluid intake. It is not necessary to take it with food. Options C and D are incorrect instructions for those taking Bactrim. 8. A client calls the evening health clinic to state, "I know I have a severely low sugar since the Lantus insulin was given 3 hours ago and it peaks in 2 hours." What should be the nurse's initial response to the client? A. What else do you know about this type of insulin? B. What are you feeling at this moment? C. Have you eaten anything today? D. Are you taking any other insulin or medication? 8b. What are you feeling at this moment? When a client has changed from stable to unstable, the nurse's initial response should be to do further assessment of the client. 9. The nurse is caring for a client who is receiving total parenteral nutrition, TPN, hyperalimentation, and lipids. What is the priority nursing action on every 8-hour shift? A. Monitor blood pressure, temperature, and weight. B. Change the tubing under sterile conditions. C. Check urine glucose, acetone, and specific gravity. D. Adjust the infusion rate to provide for total volume. 9c. Check urine glucose, acetone, and specific gravity. Because of the high dextrose and protein content in parenteral nutrition, the nurse should assess the urine at least every 8 hours. 10. The nurse reviews an order to administer Rh-D, immune globulin, to an Rh-negative woman following the birth of an Rh-positive baby. Which assessment is a priority before the nurse gives the injection? A. Newborn's blood type. B. Coombs test results. C. Previous ROGAM history. D. Gravida and parity. 10b. Coombs test results. Rh-D, immune globulin, ROGAM, is given only if antibody formation has not occurred. A negative Coombs test confirms this. 11. A client has been on antibiotics for 72 hours for cystitis. Which report from the client requires priority attention by the nurse? A. Foul-smelling urine. B. Burning on urination. C. Elevated temperature. D. Nausea and anorexia. 11c. Elevated temperature. Elevated temperature after 72 hours on an antibiotic indicates the antibiotic has not been effective in eradicating the offending organism. The provider should be informed immediately so that an appropriate medication can be prescribed, and complications such as pyelonephritis are prevented. Options A and B are expected with cystitis. Option D may be related to the antibiotics as a side effect and should also be reported to the provider. 12. The nurse is caring for a school-aged child with a diagnosis of secondary hyperparathyroidism following treatment for chronic renal disease. Which of the following lab data should receive priority attention? A. Calcium and phosphorus levels. B. Blood sugar. C. Urine-specific gravity. D. Blood urea nitrogen. 12a. Calcium and phosphorus levels. Calcium and phosphorus levels will be elevated until the client is stabilized. 13. When caring for a client with urinary incontinence, which content should be reinforced by the nurse? A. Hold the urine to increase bladder capacity. B. Avoid eating foods high in sodium. C. Restrict fluid to prevent elimination accidents. D. Avoid taking antihistamines. 13d. Avoid taking antihistamines. Antihistamines can aggravate urinary incontinence and should be avoided by these clients. Holding the urine, avoiding sodium, and restricting fluids have not been shown to reduce urinary incontinence. 14. A client returns from the operating room after a right orchiectomy. For the immediate post-operative period, the nursing priority would be to A. Maintain fluid and electrolyte balance. B. Manage post-operative pain. C. Ambulate the client within 1 hour of surgery. D. Control bladder spasms. 14b. Manage post-operative pain. Due to the location of the incision, pain management is the priority. Bladder spasms are more related to prostate surgery. 15. A client with a fracture of the radius had a plaster cast applied 2 days ago. The client complains of constant pain and swelling of the fingers. The first action of the nurse should be: A. Elevate the arm no higher than heart level. B. Remove the cast. C. Assess capillary refill of the exposed hand and fingers. D. Apply a warm soap to the hand. 15C. Assess capillary refill of the exposed hand and fingers. A deterioration in neurovascular status indicates the development of compartment syndrome, elevated tissue pressure within a confined area, which requires immediate pressure-reducing interventions. 16. A client is 2 days post-operative. The vital signs are BP 120/70, HR 110 BPM, R 26, and temperature 100.4 degrees Fahrenheit, 38 degrees Celsius. The client suddenly becomes profoundly short of breath, skin color is gray. Which assessment would have alerted the nurse first to the client's change in condition? A. Heart rate. B. Respiratory rate. C. Blood pressure. D. Temperature. 16B. Respiratory rate. Tachypnea is one of the first clues that the client is not oxygenating appropriately. The compensatory mechanism for decreased oxygenation is increased respiratory rate. 17. A client is waiting to have an intravenous pyelogram, IVP. The most important information to be obtained by the nurse prior to the procedure is: A. Time of the client's last meal. B. Client's allergy history. C. Assessment of the peripheral pulses. D. Results of the blood coagulation studies. 17B. Client's allergy history. Intravenous pyelogram is a dye study that uses an iodine-based contrast. Therefore, the study is contraindicated in clients with allergy to iodine. 18. What must the nurse emphasize when teaching a client with depression about a new prescription for nortriptyline, Pamelor? A. Symptom relief occurs in a few days. B. Alcohol use is to be avoided. C. Medication must be stored in the refrigerator. D. Episodes of diarrhea can be expected. 18B. Alcohol use is to be avoided. Alcohol potentiates the action of tricyclic antidepressants. 19. Before administering a feeding through a gastrostomy tube, what is the priority nursing assessment? A. Measure the vital signs. B. Palpate the abdomen. C. Assess for breath sounds. D. Verify tube patency. 19D. Verify tube patency. Tube patency should be checked prior to all feedings. The feeding should not be attempted if the tube is not patent. 20. The nurse is caring for a client with a vascular access for hemodialysis. Which of these findings necessitates immediate action by the nurse? A. Pruritic rash. B. Dry, hacking cough. C. Chronic fatigue. D. Elevated temperature. 20D. Elevated temperature. It is a priority to report this finding since clients on hemodialysis are prone to infection, and the first sign is an elevated temperature. The other findings should be reported to the provider as well. 21. The nurse is caring for a client several days following a cerebral vascular accident. Coumadin, warfarin, has been prescribed. Today's prothrombin level is 40 seconds, normal range 10 to 14 seconds. Which of the following findings requires priority follow-up? A. Gum bleeding. B. Lung sounds. C. Holman sign. D. Generalized weakness. 21A. Gum bleeding. The prothrombin time is elevated, indicating a high risk for bleeding. Neurological assessments remain important for post-CVA clients. 22. The registered nurse, RN, is making decisions regarding client room assignments on a pediatric unit. Which possible roommate would be most appropriate for a 3-year-old child with minimal change nephrotic syndrome? A. 2-year-old with respiratory infection. B. 3-year-old fracture whose sibling has chickenpox. C. 4-year-old with bilateral inguinal hernia repair. D. 6-year-old with a sickle cell anemia crisis. 22C. 4-year-old with bilateral inguinal hernia repair. The nurse must know that children with nephrotic syndrome are at high risk for development of infections as a result of the standard use of immunosuppressant therapy, as well as from the accumulation of fluid, edema. Therefore, these children must be protected from sources of possible infection. D is incorrect because the sickle cell crisis is potentially due to an infectious process. 23. The nurse is caring for a pregnant woman with pregnancy-induced hypertension, PIH, receiving magnesium sulfate intravenously. In assessing the client, it is noted that respirations are 12, pulse and blood pressure have dropped significantly, and 8-hour output is 200 milliliters. What should the nurse do first? A. Administer calcium gluconate. B. Call the provider immediately. C. Discontinue the magnesium sulfate. D. Perform additional assessments. 23C. Discontinue the magnesium sulfate. The assessments strongly suggest magnesium sulfate toxicity. The nurse must discontinue the 4 immediately and take measures to ensure the safety of the client. 24. A client has a serum glucose of 385 mg per dl. Which of these orders would the nurse question first? A. Repeat glycohemoglobin in 24 hours. B. Document AccuChecks, intake and output every 4 hours. C. Humulin N 20 units, 4 push. D. 4 fluids of 0.9% normal saline at 125 milliliters per hour. 24C. Humulin N 20 units, 4 push. Regular insulin is the only insulin that can be given by the intravenous route. This is the initial order to question. Option A should also be questioned, although it is not a priority since the client would not be harmed by this action. This lab test gives the average glucose on the hemoglobin molecule for the past 2 to 3 months. There would be no need to repeat it at this time. A fasting glucose in the morning would be a more appropriate assessment. The other orders are within expected actions in this situation. 25. The nurse performs an assessment during a fluid exchange for the client who is 48 hours post-insertion of an abdominal Tenkov catheter for peritoneal dialysis. The nurse knows that the appearance of which of the following needs to be reported to the provider immediately? A. Slight pink-tinged drainage. B. Abdominal discomfort. C. Muscle weakness. D. Cloudy drainage. 25D. Cloudy drainage. Cloudy drainage is a sign of infection that can lead to peritonitis, inflammation of the peritoneum. The other options are expected side effects of peritoneal dialysis.